Good morning. This is Dr. Nitin Balakrishnan. I am the Chief Medical Director of Saideep Eye Clinic and Crystal Vision Laser Center in Mumbai. I also head the Department of Ophthalmology at Nanavati Super Specialty Hospital in Mumbai. I have been a practicing cataract and refractive surgeon for the past 30 years in private practice. And I would like to talk about defining the 3 C's of cataract surgery, that is customization, control, and confidence. When we speak about customization, the first question which comes to our mind is why customize? Well, the answer is very simple, that one size doesn't fit all. So obviously, for giving the best to our patients, we need to customize. And there is a general myth that customization is possible only with high-tech instruments or with spending lakhs and crores of rupees to get the latest equipment, and only then you can customize. Well, that is not true. There are ways that a general ophthalmologist or a cataract surgeon can customize even without the use of high-tech instruments. For example, simple things like understanding the patient's work profile, understanding the patient's lifestyle, understanding what is the expectation of the patient, what is his desire to go totally glass-free. These are important points for an ophthalmologist to understand, to know what sort of a lens to implant into a patient's eye. At the same time, he can address issues like astigmatism without using expensive lenses like the toric IOL. He can change the site of the incision. He can operate on the steep axis, and by operating on the steep axis, the astigmatism can be decreased. Further amount of astigmatism can be further brought down by doing limbal relaxing incisions. These are things which do not require high-tech equipment. It's whatever is available in your day-to-day practice, which probably every ophthalmologist has been using. At the same time, there are ways and means of using high-tech technology to customize. Probably the best technology today available in the market for customizing in cataract surgery is the Varion, that's the image-guided system. When we talk about Varion, people think that it is only an image-guided system which gives you an overlay into your microscope for making the incisions, the capsular rhexis, and the toric placements of the IOL or the final positioning of the IOL. This is true, it does this, but it does much more. There is an initial reference unit which is used, which measures the total keratometric power of the patient's cornea. It also measures the axis of the curvature and the radii of the curvature in both the meridians K1 and K2. It also takes high resolution digital image of the eye, which captures the scleral vessels, the iris images, and this acts as a fingerprint for reference, which is then transferred on to the digital marker in the operation theatre, which gives you the overlay to get the right position. But what is more interesting and what is more important is the planning station. Well, the planning station has a software which not only decides what sort of, it has probably all the latest formulae for calculating the IOL power, including the Barrett suite, which probably today is the best formula available because it takes into consideration not only the anterior corneal curvature, but also extrapolates and considers the posterior corneal curvature. At the same time, it also takes into the consideration the effective lens position. Now, because it takes into consideration the effective lens position, this is a very, very accurate formula. So, the Varion planning station has the Barrett suite. It is an excellent tool to also use in cases of post-refractive surgery IOL implantation, IOL power calculation. So, once you choose the formula, it gives you not only the power of the implant to be used, but also gives you what sort of a residual refraction will be left behind, not in the form of only a sphere, but a sphere, a cylinder, the axis, and also the spherical equivalent, which will be left behind. Now, this can be further refined by changing the lens, changing the incision position. So, you can change the incision position from probably a 180 to a 30 or a 120, depending upon which is the position for giving you the least amount of astigmatism. It also helps you to plan LRIs and toric IOLs. It tells you which axis to place the toric IOLs. But what is more important, in case there is a refractive error left behind, even with the toric IOL, cylindrical refractive error, that can be covered by doing a blended toric IOL with an LRI, that is a limbal relaxing incision. So this particular technology has taken cataract surgery to a different level, and it is probably the best technology, like I said initially, for customizing the cataract surgery. The other methods of customization are choosing the right lens for the right patient. For example, in cases of a post-refractive surgery, what happens here is that in myopia and in hyperopia, there are changes in the corneal curvature which is done following a myopic or hyperopic LASIK. So in a myopic LASIK, you're making the cornea flatter. In hyperopic LASIK, you're making the cornea steeper, because of which there is an altered anterior-posterior corneal curvature ratio. Now, the problem comes up with a formula error which occurs because what happens is each formulae consider the relationship between the effective corneal power and the effective lens position. So because of this, because of the altered anterior-posterior corneal curvature, there is a difference, there's an error which is produced, and therefore in case of myopia, you can get a hyperopic surprise, and in case of hyperopia, you can get a myopic surprise if you follow a routine formula. So obviously the best formula to follow in these cases is again the Barrett suite, which is available free of cost from the APS-CRS website, or one can use the Warren Hill Wangcock formula, which is available on the ASCRS website. Again, both of these are free of charge to use. This gives us the exact power in cases of post-refractive surgery. Having said that, one also needs to understand what are the changes in the Zernicke's polynomial which occurs following a myopic or a hyperopic LASIK. So following these, there is a change in the corneal asphericity which occurs in myopic as well as in hyperopic LASIK. So depending on whether a myopic LASIK has been done or a hyperopic LASIK has been done, one needs to choose a lens in such a way that the asphericity of the lens negates the asphericity of the cornea to try and get an end result of a zero asphericity. Well, this was regarding speaking on customization. The next point which you would like to talk about is the control. Now, the control can be divided into a logistic control, which includes things like operating on the correct eye, maintaining a proper OT roster so that you operate the right patient, that the right implant is going into the right patient's eye, checking the OT sterility. These are things which are very, very paramount in any cataract surgery. One also needs to have a proper control of all the consumables which are used, which go into the patient's eye. At the same time, to check things like the irrigating solution to see whether any floaters or any foreign bodies or any fungi which is probably there in a very, very few cases. But for a particular patient in whom you are using these solutions, it could be 100% visual loss, which is definitely not acceptable in any point of time. So that was about the logistic control. One also needs to have a control on the procedure. So by control on the procedure, I mean one needs to see to it that each step of the procedure, like a capsular excess, the phacoemulsification, the lens implantation, all are controlled, and this comes from experience and from learning from the masters. So one needs to see a lot of YouTube movies, films of the masters who are operating, attend conferences, see their surgeries. At the same time, it's always a good idea to have your surgeries audited by someone senior. It need not even be someone very senior. It could be a colleague of yours who would audit your videos just to point out small errors which otherwise become a habit over a period of time. Some errors, you're constantly doing it. It doesn't affect your day-to-day practice, but these errors become a habit, and one doesn't even realize one has these errors. So it's a very good idea to have your videos audited by a colleague, a peer, so as to improve your results. At the same time, one should also think about the control of the parameters. So we're using a lot of parameters in phacoemulsification. So one has to be sure that one is using the right parameters for the right case, like horses for the courses. For example, in case of a hard cataract, one would use a high vacuum and maybe a continuous phaco power. In case of a posterior polar cataract, one should think of using a very, very slow motion phaco with low parameters. And in cases of zonular dehiscence, again, the flow into the eye has to be very slow so that one doesn't increase the dehiscence due to the wrong parameters. Coming now to the confidence. Well, confidence is a thing which can come only with experience and with control. And as you keep operating more and more, keep seeing more and more and learning more and more, one tends to get more and more confident of handling real difficult cases like the ones where there are absent zonules for a large amount of clock hours, cases like subluxated lenses, where in the past one would think of just going in and doing an intracapsular vectis removal. Today you can do a phacoemulsification, fixate the bag to the wall of the sclera using a capsular tension ring or a ring segment, and at the same time put in the posterior chamber IOL within the bag, which is probably a thing which was never heard about a few years from now. So the important thing is not only to the confidence to manage difficult cases, but also to manage complications. Well, to note the complication occurring at the right time and to manage the complication in an effective manner. So all in all, one needs to pay attention to all these 3 C's which define any cataract surgery. I'll repeat again: customization, control, and confidence. Thank you for your patient hearing.